What exactly is uterine fibroid and why does it affect certain women? What causes uterine fibroids and what precautions can we take to keep ourselves away from uterine fibroids? Next few minutes, we are going to unearth all the answers. Stay tuned. Namaste. I'm Dr. Sanchita Dharne. Let's understand what exactly are the uterine fibroids. These are tumor growths that occur on the walls of the uterus. These are mostly non-cancerous or benign tumors in women of childbearing age. Uterine fibroids are also called uterine leiomyoma. In terms of size, to give you a perspective, uterine fibroids are as small as an apple seed and they can be as large as a grapefruit. Evidence suggests that uterine fibroids are linked to hormonal imbalance and genetics. Fibroids are not seen to be developed before first menstruation. That is, when the body starts producing a particular hormone known as estrogen. High dominance of estrogen in the body can trigger formation of fibroids and growth. A lot of women that have fibroids don't usually experience any symptoms, while others experience symptoms like pain, bleeding, and the rest, which we will discuss later. Fibroids are more common in women from age 30 to age 50. According to the Office of Women's Health, 20 to 80% of females develop fibroids by the age of 50. The prevalence of uterine fibroids range from 4.5% in UK to 9.8% in Italy, reaching 9.4% in UK to 17.8% in Italy in the age group of 40 to 49 years. The highest incidence of uterine fibroids was seen in Pakistani women 78%, followed by rural Indian women 37.65%, and in urban India it is 24%. These are some startling numbers. Uterine fibroids are almost always non-cancerous. When a fibroid is cancerous, which is usually very rare, it is called leiomyosarcoma. Now that we have known what uterine fibroids are, we are going to identify the types and where they are located within the uterus. There are three main types of uterine fibroids. First, the subserosal fibroids, the intramural fibroids, and the third, the submucosal fibroids. Their classification usually depends on their location. The subserosal fibroids usually grow outside the uterus. They are the most common types of fibroids. The intramural fibroids grow inside the muscular wall of the uterus, while the submucosal fibroids grow in the open space inside the uterus, which is the uterine cavity below the layer of the uterus. Some fibroids can also become pedunculated, in which they develop a stalk that is attached to the uterus. As I mentioned earlier on, many females usually experience no symptoms of fibroid. However, those that experience symptoms usually go through things like heavy menstrual bleeding, which can lead to anemia, prolonged menstrual periods, pelvic pressure or pain, frequent urination, constipation, backache or leg pain, difficulty in emptying your bladder, painful periods, pain during sexual activity, and discomfort or feeling of fullness in the lower abdomen, especially in the case of large fibroids. Fibroids have also been linked with fertility problems. It may also cause problems during pregnancy and labor, increasing the chances of needing a cesarean delivery. It remains unclear exactly what causes uterine fibroids. However, their causes may be linked to different factors like genetic abnormalities, which may affect the development of fibroids. For example, ALU sequences in rearrangements can lead to disruption of genes and hence loss of control of gene expression, leading to uncontrolled cell growth. This can lead to the formation of fibroids. Another cause for fibroids may be linked to family history. The history of a person's family can be a risk factor for uterine fibroids. For example, women whose mothers and sisters had fibroids have an increased risk for developing them too. Research has shown evidence that the consumption of alcohol, caffeine, and red meat are associated with an increased risk of fibroids. Overweight and obesity are also associated with an increased risk of fibroids. Another factor that is associated with fibroids is hormonal imbalance. During a person's reproductive years, the estrogen and progesterone levels are higher. When these estrogen levels are high, especially during pregnancy, fibroids tend to swell. Low estrogen levels cause the fibroids to shrink. This can happen during or after menopause. Research has also shown a link between high blood pressure and fibroids. Elevated blood pressure may cause injury to the smooth muscle cell, releasing cytokines that now increase the risk of uterine fibroid growth. The deficiency of vitamin D and menstruation at an early age, that is early menarche, are also risk factors for uterine fibroids. Now that we have known the symptoms, causes, and risk factors for fibroids, let us see the various ways in which we can prevent uterine fibroids from occurring. Every day, researchers continue to study the causes of fibroids, but as of now, there is little scientific evidence on how to prevent them. Preventing uterine fibroids may not be possible, however, only a small percentage of these fibroid tumors require treatment. But making healthy lifestyle and diet choices, such as maintaining a normal weight and taking regular exercises, eating fresh fruits and green vegetables like collard greens, cauliflowers, tulip greens, arugula, cabbage, and broccoli could help lower your odds. Cutting back on your alcohol intake really helps to reduce the risk of fibroids. This is because alcohol raises the level of hormones needed for fibroids to grow. So you should limit your alcohol intake to help reduce your risk. The use of green tea extract and drinking green tea could also help against fibroids. You can also take vitamin D supplements along with foods like egg yolks, cod liver oil, fatty fish such as salmon, mackerel, and tuna, fortified milk, cereals, and orange juice to help increase your vitamin D levels, thereby reducing your risk of having fibroids. Foods rich in fiber like cooked and raw fruits and vegetables, dried fruits, oats, cruciferous vegetables like turnips, cabbage, arugula, whole grain bread, lentils, and barley help to aid weight loss and balance hormones. You should consider making these foods part of your regular diet. Also, potassium-rich foods like avocados, potatoes, tomatoes, bananas, lentils, oat bran, citrus, collard greens, and dates help to balance the blood pressure, which then reduces your risk for fibroids. These foods should also be added to your diet. Also, add dairy products such as yogurt and full-fat cheese to your diet. Dairy products are very rich in calcium, magnesium, and phosphorus. These minerals can be helpful in preventing fibroids and slow down their growth. If you have fibroids, you should avoid foods such as foods high in sugar and carbohydrates like glucose, table sugar, white bread, pasta, flour, potato chips, crackers, corn syrup, energy bars, soda, and other sugary drinks. These foods may trigger or even worsen fibroids. They increase the blood sugar levels, causing weight gain and affecting fibroid growth. Foods such as red meat, soybeans, milk, tofu, and flax seeds have negative effects when consumed in high amounts. These foods may also increase the estrogen levels in the body, thereby increasing the risk of having fibroids. I hope you really found this much coverage on uterine fibroids useful. Please consider subscribing to the channel and hit that like button. In the subsequent videos of this playlist on uterine fibroids, we are going to cover how to ascertain presence of uterine fibroids in our body and what are the top homeopathic remedies for uterine fibroids. So, don't forget to subscribe. See you in the next. Till then, stay healthy, stay safe.